Hello everyone. In this video we will be discussing the drug Tolvaptan, made and presented by Fawaz, Yumna, Amber and Zion. Tolvaptan is a drug that acts as a vasopressin receptor antagonist, used in conditions of euvolemic and hypervolemic hyponatremia. From the name of the drug, we can derive few important details. First, TAN, referring to its antagonist action. VA, noting involvement of vasopressin receptors. Vasopressin is also known as antidiuretic hormone. And tolvaptan as an antagonist acts as a diuretic. And TOL pointing the presence of toluene in the chemical structure of the drug. Along with tolvaptan, there are other vasopressin blockers such as conivaptan, which is a non-selective V1A and V2 antagonist and given by IV route, and lixivaptan, like tolvaptan, is a V2 antagonist and given orally. Doses of each vary as well as their elimination half-life. This drug was first FDA approved in 2009 under brand name of Samska and generic name as Tolvaptan by the Otsuka Pharmaceutical Development and Commercialization Incorporation. Let's look at the chemical structure of tolvaptan. It is a racemate consisting of a 1-to-1 mixture of 5R and 5S ster isomers. It has groups of benzazepine and benzene dicarboxamide, as we can see here, also has toluene group. The chemical formula is C26H25ClN2O3. Let's discuss the pharmacology of tolvaptan. The pharmacokinetics include its absorption, distribution, metabolism and excretion. As mentioned before, it's orally administered. It binds reversibly to plasma protein at 98% and its volume of distribution is 3 L per kilogram of drug. The biotransformation or metabolism is done by CYP3A4 enzyme in liver, and then excreted mostly by non-renal routes or fecally, and less than 1% of drug excreted uncharged in urine. Now let's understand the pharmacodynamics and mechanism of action of tolvaptan. First, let's see how vasopressin acts on receptor. Initially, the serum osmolarity is 700 osmoles per liter, as we can see here. When vasopressin in blood binds to the V2 receptor on the epithelial cells, the adenyl cyclase converts the ATP to AMP. This camp with protein kinase A to synthesize some ion channels called aquaporins, which can bind on the apical membrane and facilitate reabsorption of water from the filtrate right here. And due to this water, we can see that the concentration of serum sodium has gone down to 300 osmoles per liter. Now let's see how tolvaptan works to increase serum sodium concentrations. It blocks the binding of this vasopressin here to its receptors, which will prevent the synthesis of aquaporins, which help water retention. Therefore, no more water is reabsorbed and allows normal excretion of water, acting as a diuretic, thus increasing the serum sodium levels. As you can see in this diagram, where terlipressin is a vasopressin agonist and tolvaptan as an antagonist in the nephrons of kidney. When serum sodium levels drop below 130 milliequivalents per liter, which can be either euvolemic or hypervolemic hyponatremia, and due to SIADH, syndrome of inappropriate antidiuretic hormone, where ADH is abnormally increased, an ADH increase which causes increased blood pressure and risk of heart failure. In all of these cases, tolvaptan can be administered to increase serum sodium level back to normal and reduce water absorption. So we can now clearly understand tolvaptan blocks the antidiuretic activity of vasopressin by binding to the V2 receptors, inhibiting vasopressin. Now we will move to the precautions. One of the important precautions is that this drug can cause a condition called osmotic demyelination syndrome. This drug will increase serum sodium levels, so when the serum sodium level is less than 130 milliequivalent per liter, this tolvaptan drug can be given. At this condition, very few molecules of sodium are present within the serum. So when low dose of tolvaptan 15 mg is administered, then serum sodium level may increase. Suppose they elevated above 140 milliequivalent per liter within 24 hours. Now we can observe that more number of sodium molecules within the serum, which increases the osmolarity. So the neurons supplying to the brain are going to be demyelinated, resulting in the osmotic demyelination syndrome. In this syndrome, we can observe symptoms like dysarthria, difficulty in speech; dysphagia, difficulty in swallowing; mutism, inability or unwilling to speak; lethargy, lack of energy; seizures, coma, and even death can be observed with this demyelination syndrome, so tolvaptan should not be used for sudden increase of sodium level. Similarly, it can also cause liver injury when this drug is used for long term. There will be symptoms like anorexia, which means loss of appetite, fatigue, right upper abdominal pain, dark color urine, and jaundice. If any of the symptoms observed in this patient, it may indicate liver injury. So care should be taken to monitor the liver functionality, and this liver injury is observed within 18 months of treatment of this drug. This may also be fatal to the patient. Since this drug going to increase urination, it can cause dehydration and hypovolemia. So if already patient have these conditions, then care should be taken. Similarly, if patients use diuretics like loop diuretics such as furosemide, which can further increase the dehydration and hypovolemia. So far we have understood quite a few important points about tolvaptan as summarized here. It acts on V2 receptor located on the epithelial cells of the nephron. And functions include correction of hyponatremia by blocking effect of vasopressin, and also causes weight reduction and decrease in ascites volume. Next we will look at the drug-drug interactions. Tolvaptan is metabolized by CYP3A4 enzyme, which can be blocked by many drugs such as rifampin, rifabutin, phenytoin, barbiturates like phenobarbital and carbamazepine. They competitively inhibit at the CYP3A4 enzyme, which can inhibit the metabolism and increase the level of tolvaptan in blood. When the serum level of tolvaptan increases, it can produce severe dehydration, hypovolemia, liver injury, and other complications. Similarly, this drug is substrate for P-glycoprotein. Cyclosporin. When it is given the tolvaptan, it can inhibit the P-glycoprotein, so there will be an increases level of tolvaptan within the serum. So these drug-drug interactions should be thoroughly checked before the tolvaptan is prescribed. Main food interaction or contraindication for tolvaptan is the grapefruit juice. A chemical in grapefruit suspected to be furanocoumarin binds to CYP3A4 and inhibits or reduces metabolism of tolvaptan, thus increasing the drug concentration in blood, which can become toxic to the body. During pregnancy, as FDA has categorized medications into A, B, C, D, and X, tolvaptan falls into the C category, where it's a moderate risk to intake drugs for the baby and mother. Tolvaptan is contraindicated in emergency increase of serum sodium levels. Just we have discussed that sudden spike in serum sodium level may cause demyelination syndrome. That's why tolvaptan is contraindicated in the emergency treatment of hyponatremia. Similarly, this drug is contraindicated in patients who are unable to produce response to the thirst. This drug is increase the urination, which increase the thirst and dry mouth. Similarly, this also contraindicated in the patients who has hypovolemia, hypotension, and renal failure. Another contraindication of the drug is ADPKD, autosomal dominant polycystic kidney disease. In this condition, cysts are formed within renal system, which resulting in improper ADH secretion. Against such condition, tolvaptan may increase hypovolemia, so it is contraindicated. This drug is also contraindicated in the patients who are unable to produce urine, because this drug acts by increasing the water excretion within the urine. And this drug is contraindicated in the hypersensitivity actions such as anaphylaxis, and also contraindicated with other few drugs. Ketoconazole, itraconazole, ritonavir, and sequinavir, which are CYP3A4 strong inhibitors that increase the level of tolvaptan, resulting in its toxic effects. So these all conditions tolvaptan is contraindicated. Let's move to side effects. These are some important side effects of tolvaptan, mainly related with renal system. It can cause dry mouth because more excretion of water with urine. Asthenia, which means lack of energy. Increased thirst in patient. Constipation, polyuria, which means diluted urine, and hyperglycemia. How it is given. This drug is given as tablet form and it is available at two strengths, one as 15 mg and the other one as 30 mg. Initial dose of drug is low dose, it is started with 15 mg once a day. The dose can be slowly increased with an increment of 15 mg after 24 hours, and the maximum dose that can be achieved is 60 mg once a day. So this drug can be used maximum dose of 60 mg per day to control hyponatremia. But duration of this drug less than 30 days in order to prevent liver injury and osmotic demyelination syndrome. Brands of Tolvaptan available in the market include that Tolvaptan can only be administered under hospital supervision, it's not an OTC drug. That's it for the video. Thank you.